Hello, everyone. My name is David Ellwood, and I want to welcome you to this very special webinar where we'll be talking about some of the really most important things going on in the world today still. So what I want to do is to start by just saying a few words. I mean, I regard the current situation as terrifying and difficult a time as I can quite remember politically in every other way. And I'm sure most everyone on this webinar is feeling the stress and concern and so forth. But I would like to add that, you know, in a few weeks, something will have happened. And I think many people are expecting Joe Biden will be elected president, though with perhaps some turmoil afterwards. And I think everyone is just kind of holding their breath and don't want to say anything, and not focused much beyond that period. And I think that's really quite understandable and maybe appropriate. But the thing that I would like to point out is after 3 weeks, the time will come, one way or the other, where we have to decide where we're going to move next and what the country's going to do and so on. And to me, it's tempting to sort of say, well, let's just go back. But that is obviously not going to happen. And they're just enormous challenges that we face. And it's time to be thinking hard about what it's going to take. And healthcare is absolutely at the top of that list. We've obviously been going in a very different direction for the last 4 years. And so either if Biden has been elected, it'll be time to be thinking about the future or of a Biden administration, or if Trump has been reelected, how to think about the future going that way. And our panelists today are the sorts of people that are thinking way beyond the next 3 weeks and really fundamentally asking, what's it going to take? And where do we want to be? Where can we hope to be? And what should we be planning to have happen? And I think the striking thing that you'll hear, and by the way, I just want to say this panel is being, the book, here, I have to put this book in front of my face for it to work, but this book, Marching Towards Coverage, that Rosemarie Day has written is really quite an extraordinary piece of work, because what it does is it's just particularly impressive that it comes from someone from the Kennedy School, because it talks in detail that people actually can understand about what's going on and what the history has been and so forth. But unlike many, she says, but what it's going to take is a movement. What it's going to take is a group of people coming together, almost certainly led by women, to really find a way to get to universal coverage and to make that a movement that we have to help succeed. And so I want to briefly introduce both of our panelists and then just open it up. And let me start by introducing Rosemarie Day, which is particularly fun. Both of these people, by the way, are Kennedy School graduates of years past. I won't date any of us, but they did graduate from different programs in the same year and knew each other. And they even had some faculty member that, like me, and so they survived it. And so there's evidence that there is life after that. But Rosemarie went to Stanford, has done a variety of compelling things before coming to Kennedy School. But she went from the Kennedy School and started working in the Medicaid Bureau and ultimately became the head of operations for Medicaid of Massachusetts, which is a huge, multi-billion-dollar activity. Then when I was lucky enough to be named dean, just about the first phone call I made was to Rosemarie to see if I could talk her into becoming the chief of staff for the Kennedy School. Why someone would give up a job overseeing billions of dollars and come to the Kennedy School, that was I don't know quite how I managed to make that happen, but we did. And it was actually absolutely essential to the ultimate future of the Kennedy School. And much of what the Kennedy School now can be traced to the work that Rosemarie and others did during that very early period. Then Rosemarie left, and she decided to focus on something rather important, which was she was then the deputy director or something of the connector in Massachusetts, and as much as anybody was responsible for putting together a program that actually worked. And we know, because we watched what happened with Obamacare, that it isn't easy to get these systems up and running and make them work. But it really did help become a model for what came after. And then after that point, she started Day Health Strategies, which is she calls it a mission-driven, women-driven consulting firm. It's been going on for 10 years. And when people in states across the country and others have looked for ways to make the ACA work, she's one of the top people they would turn to. She's also a mother, a breast cancer survivor, and increasingly an activist. So she is extraordinarily well positioned to think through how we might get to a different place. Wanda McClain, as I mentioned, is also a Kennedy School graduate, and she's a native of New York City. She came to the Kennedy School after working in the finance industry, and she wanted to work on what she calls the moral determinants of health. And she's done a variety of things, but now she's the vice president for community health and equity at Brigham Health. It's obviously one of Boston's largest and most highly regarded academic medical centers. She's, for example, been focused heavily on how to make sure COVID tests and the like don't suffer from the same kinds of racialized and other kinds of prejudicial experiences that we have throughout the healthcare system. And indeed, she's also been put on the governor's task force for making sure that the vaccine is both wisely and thoughtfully distributed across the Commonwealth and beyond. So the two of them met 30 years ago in the Kennedy School Women's Caucus, so it's particularly appropriate that they should be with us here today. They're going to talk back and forth for maybe half an hour or so, and then we will open it up for comments or questions. But without further ado, let me turn it over to Rosemarie Day. And let me just warn you, as on all Zoom calls, I think this is okay to say, she's at her parents' house, so whatever happens with, right now, she's not living there, she's just visiting. But, you know, Zoom calls being what they are, you never know what could happen. Rosemarie, welcome.
Thank you, David. Yes, I'm actually in the throes of caregiving as we speak, but I stepped outside to do this. So I'm living what we're talking about in so many respects. But thank you so much for having me and Wanda, and to host this conversation today as we think about really the crises of 2020. And I wrote this book before the pandemic and before the murder of George Floyd, though for any of us who've been really paying attention, that was not a singular event. And so there are topics that I covered in the book that very much relate to the crises of today, but the need for what I was calling for, I think, has only become amplified. But what I'd like to do is just start with a little bit of the why I wrote the book, and then I think Wanda and I will kind of go back and forth with the conversation. And it is very much my pleasure to be here with Wanda, who is, I regard as one of the consummate professionals who has achieved tremendous success in her sphere, and I am honored that she's my friend as well. So in terms of why I wrote the book, I felt that the election results of 2016 put the ACA into dire jeopardy. Trump's election and frankly the troika of Trump, McConnell, and Paul Ryan, to me, if I were a betting person, would have spelled the death knell of the ACA. And on a rational basis, I was really confounded by that, because I knew we had done this in Massachusetts in a very bipartisan fashion, with business interests at the table, a Republican governor, a Democratic legislature, advocates at the table, kind of a whole blend of things. And that I felt we had found a uniquely American way to come up with a path to universal health care, and that we were just going to take that to 49 other states. And of course, it became so fraught politically, and we can get into that if we want to some more. But by 2016, you have Trump campaigning on repealing the Affordable Care Act on day one. That was one of his early promises. And that was back when maybe more people were believing the things that he said. And he certainly had, again, the political forces seemed to be aligned. So that felt like an existential crisis on one level. And then 2017 happened, and a lot of things happened for me personally that brought this really to a head, and that included my own diagnosis with breast cancer, and my being a part of the whole #MeToo awakening that happened at the end of 2017. So I'll just say that my feminist hackles got raised in a very profound way. On the positive side was the Women's March that took place the day after the inauguration in January of 2017, where millions of people came together around the world, and predominantly in this country, but honestly around the world, in the biggest single day protest that had ever happened, peacefully, to put forward a vision for a better future. And it was really remarkable, I thought, that so many women who had never seen themselves as activists came out and marched. And that included my 80-year-old mother, who joined me in Washington, D.C. with my friends and my sister-in-law. And she had never done anything that you could have called radical in her life. And boy, did she want to be there. And it's something that we'll never forget. So the power of how that felt and the positive aspect of that helped me start to counteract what I saw as a lot of profound amount of negativity that was happening in 2017. Of course, I hadn't seen 2020 yet, but 2017 called for doing more than I had done to date. And it culminated in deciding to write this book. I mean, it really was either after the march, it's like, are you going to run for office? You know, because I was already voting, I was already donating, I was already doing a bunch of the things. So how do you step it up? I chose to write this book and try to get out onto the speaking circuit to really spread the message about why healthcare. I went beyond, let's just defend the ACA. I decided if I'm going to do this, let's go for the gusto and get to where every other wealthy country has, which is in making healthcare a right. And I really, again, wanted to focus on a positive message and not just be trying to play defense, but truly create that vision for the future. So that was the genesis of the book and some of the key themes.
Now, Rosemarie, I remember when you were writing the book, and one of the things that you said was this was going to be kind of a how-to for women, how to get involved, how to, how to make our voices heard. In the couple of years since the book has been written, can you talk a little bit about whether you've seen that transformation take place? Certainly we've seen women get elected to higher offices. I just wonder if you might, talk a little bit more about that too, because I remembered being inspired by that call to action.
So, I benefited, so I hadn't written a book before, and really mostly as a consultant dealt in PowerPoint slides. So this idea of how you need to communicate in long form narrative was going to be a real pivot for me. And I was fortunate to get to go to a writers conference that actually Harvard Medical School hosts every year for people writing about healthcare issues. And I learned a lot. I also got to try to pitch my idea, and people really liked the idea of the book, but they said, please don't just tell me about the problems. Please tell me what to do. Then I would really want to buy your book because I feel like I'm mired in the problems. And here I was planning to do this whole policy wonky thing, and I ended up having to lop off some of my chapters because I needed to really focus more on that activism part. And so that was really kind of the first wake-up call for me, was how much the idea resonated, but only if it gave people tools. So that's been an interesting journey, because some of that's in the book, and frankly, information is power, knowledge is power. So that's a tool in and of itself. I also gave people tools on a website so that they can literally just link and go to activism sites and figure out how to get more engaged in the issues. And so that's kind of at a basic level. But what's continued to inspire me is after that Women's March, where they said, okay, women have got to do more and run for office. And of course, women feel pretty overburdened in many respects, but this idea that we just couldn't take some of this stuff sitting down led to more women running for office, which we saw a huge, uptick, relatively huge uptick in how many women are in Congress. It's record-setting numbers, though still only 24%. But the fact that more women ran, they didn't all win, but the pipeline dramatically grew, and so more women won. That was empowering, but at a level that, not everybody's going to run for office. What I also saw and read about and observed was the incredible outpouring of people coming to town hall meetings and phoning to Congress and showing up in the halls of Congress to protect the Affordable Care Act, and most notably, people with pre-existing conditions. That whole piece of the Affordable Care Act that was beyond just covering uninsured people, but truly protecting the over 100 million people in this country who have some form of pre-existing condition with which they could be discriminated against by insurers. This had became more into the nation's psyche, and particularly women. So they came out and stood in these town halls and told personal stories and said, what are you going to do about this, Congressman? Are you going to take this away from my disabled child, or from my sister who has cancer, or any of those things? And with the power of, our phones and the social media, those kinds of meetings could go viral. A video clip would just take off. And so the power that just an individual who had the courage to go and to show up and to tell the story, it could be amplified in some pretty profound ways. And that was the pushback that I think helped save the ACA and helped lead to the famous thumbs down, vote from John McClain. May he rest in peace. But it was a very grassroots effort. So it thrilled me to see what this anger translated into. And again, it was led by women. 84% of the calls to Congress were by women. That was, separate and apart. Well, really, it's all related, but you didn't have to be someone who was going to run for office. You could be a regular person, and that to me was inspiring, because it totally underscored what the people who have been professional activists, who I really look up to, like Angela Davis or Cecile Richards or Gloria Steinem, they talk about these things during the movements that we've studied as historic, and how regular people did things. And we've been seeing that in this era, it's segued into the lift there goes my computer, the lift of the Black Lives Matter movement, which also has attracted tremendous numbers of people, and has been mostly peaceful, and has shown that you can have a voice and you can get attention to issues and start to pave the way to make the difference.
Yeah, and I think the Black Lives Matter movement and what we're seeing in terms of the disparities today, in terms of who's dying from COVID disease, kind of gets back at the importance, obviously, of coverage and the importance of activism, and those two things going together. As we look at, and it also, I think, gets to how we build trust. So when you talk about, being hopeful about the future, one of the things that I'm observing is, especially as it deals with the COVID pandemic, when you have, 20-something% of the cases of people who are dying being Black, and yet, Blacks in the United States are about 12% of the population, that tells you something about our healthcare system. And I do wonder, when we think about, it goes beyond coverage, because in a lot of the cases, these people do have coverage. They may not have access, which is a whole nother complicating factor. And there is, bias and mistrust within our institutions, healthcare being the one that we're talking about right now. So, I see the role for activism playing out in many ways, obviously with women being, front and center, but people, what's been profound and the parallel between the Women's March and the Black Lives Matter movement is that they have been largely peaceful on the Black Lives Matter. I'll agree that there have been some challenges on that, but they've also been global, that people from across the world have been mobilized. So this collective action and the impact that that can have on social change is just so profoundly hopeful at this point in time. And, you know, I am certainly seeing that. And I'm hoping that, you know, we can turn the tide that we're seeing in healthcare with the legacy of, you know, racial experimentation on Black people that goes back to when Black people were enslaved in this country, that we can turn the tide and begin to get people to feel that they have a place within healthcare and that their needs are being met. It's going to take a lot of work, though, and I guess that'll be a separate book, and maybe you'll write that one.
Oh, thanks, Wanda. I have to survive this one, but no. Well, you know, I included a chapter on what you know as the social determinants of health, and I like Don Berwick coining the moral determinants of health as a way to even amplify the notion. But I put a chapter in on that. It's entire books have been written, more needs to be done, but I felt like you couldn't just talk about coverage, but I also had to keep the book manageable in length, and so I wasn't allowed to talk about as many things as I wanted to. But I do want to point out, at least on the coverage side, because this is a glaring inequity, which is the fact that under the Affordable Care Act, states were, because of the way the Supreme Court made its decision in 2012, states were given the option, this wasn't the original intent, but states were given the option of whether to expand Medicaid or not. And little by little, the vast majority of states have chosen to do so. And this was at 100% federal funding initially. Now it's 90%. But at 100%, a significant portion of states initially decided not to expand Medicaid, which meant that their poorest citizens did not get to have coverage. They had to make enough money to qualify for exchange subsidies, but if you were poorer than that, you didn't get anything new because of the Affordable Care Act. And most of these, as I know you know, are working folks. And so this state option, lo and behold, when you look at the map, the majority of states that have chosen not to expand Medicaid are in the South, and also Texas. And I guess Texas is sort of South and it's West. But I really attribute that decision of inaction to racism, because there aren't many explanations left for how you would leave so many people uncovered, because there are states that struggle economically. I mean, I could go through all the plausible reasons, and you can dispel them, and you get to this place that there's something else going on. And so there are people suffering in this pandemic who still don't have the coverage they have, and they are now deemed essential workers. And we're letting an entire swath of our country get away with this, is how I'm going to put it today, because I'm pretty mad. So I'm trying to raise people's attention that even if you're in a state that did, in my view, do the right thing, help the states, help your fellow man and woman in the states that have not had this expansion happen. And I think you can tie it to the voting rights issues, the disenfranchisement, so many things that are the legacy of slavery and discrimination. But this is a glaring gap that needs to be fixed at just baseline. And then we got to build from there. To your point, people can have insurance but still not have access. But the fact that we still have 10% of our population uninsured is reprehensible, because with this model of the ACA, we did it in Massachusetts, we got down to 2% uninsured. The model can work if the state has the will to do it, and the feds are funding the portion that they're funding.
Yeah, and if
so
you
that's
have
table stakes. Yeah.
Right, and if you have 100% or 90% funding for something and you still don't do it, then you have to wonder what goes into that calculus. And I have to agree with you. I think that a lot of it, and you know, not the anecdotal evidence seemed to suggest when you heard people talk about why they were against it, It was that someone else who was undeserving in their mind might get something that they did not deserve. And usually if the code for that undeserving was that they were Black and they did not deserve it. And as you know, you talked a bit about your own, family history, and I know you're with your parents now and managing that. But, in my own family, someone who was living in the South and was diagnosed with a deadly illness that was treatable, was denied coverage because they would not, and they would not insure them at all. And the only access they would have would have been in emergency rooms, which would have been episodic and probably, not, the care that they needed. The good news of that story is that that person was able to get themselves to a state that had full coverage and is in remission now. And so these are life and death decisions that are happening for people. And, there's a quote in your book, and I can't now remember which senator it was or which elected official who said, nobody ever died for lack of health coverage. Well, my personal experience and the data shows that is just not true.
You're right. It is absolutely not true. And I put a couple of stories to illustrate the statistics. So you're right, the research shows people have a misconception that because emergency rooms are required to take folks, that sort of is healthcare through the back door. But the fact is, and you work in a hospital system, and probably a more generous system than we have in some other states, but it's essentially a triage thing. It's not a let's admit you and do more diagnostic tests and make sure that you get all, an access to treatment of things. It's really to just sort of keep you from dying in that moment. Like I say to people, like to keep you from bleeding to death. Or if you're just about to deliver a baby, let you deliver it in the hospital. But it's very kind of dire criteria that hospitals have to follow. And then they're looking to see if you have coverage, because they've got to pay their bills. And so there's distinction between those with and without coverage. If you look at motor vehicle deaths, in accidents, you have much better results if you've got an insurance card than if you don't, because the hospitals treat you better. And so it's not really coverage, and it's a misnomer that has kind of perpetuated. So that's something I'm trying to shine the spotlight on too, for sure.
Absolutely.
Let me just ask both of you. You've been, again, mostly shining the spotlight on what's wrong and the terror, the awful things. Now tell us why we can get from here to the much more exciting and compelling starting point, which is where we should be, which is some sort of universal coverage. What's the story there? How do you get there? How are you, where does this movement lead us and how?
Well, I know when I talk about, how did the pandemic affect your book? And it's like, well, I think it only just made the message of universal health care more important. I mean, people having access to preventive care and treatment for chronic conditions and things so that if they get COVID, they'll get tested more quickly, or, people, even if there's free tests out there, people still kind of know if they don't have a card, they're scared of accessing a system where they know they could be handed some big bill. And so we've just sort of set it up to create barriers, even if in certain, extreme instances like coronavirus, we're waiving some of those. People don't necessarily know that because the prevailing culture is that you're not covered, and it's very gotcha kind of orientation. So, and the fact that we need people to get vaccines, all the things that are going to be playing out in the coming year. Okay, all of that cries out for having coverage. So the pandemic, silver lining, if I'm having a good day and can think about that, I think shows that our health and well-being has to be a national priority. The way we rallied after 9/11 and we decided that we had to protect ourselves from terrorism, international terrorism, and we created the entire Transportation Security Administration. We changed all the ways in which we travel. All of that didn't exist before 9/11. I talked to my kids about it. They can't even comprehend because it is the new normal that happened after 9/11. It's just how we do things. I would like to think the pandemic would wake enough people up to what should be the new normal, which is everyone having some basic level of healthcare, because it turns out that our lives have been in jeopardy because of not having that. And TSA isn't solving that for us.
Sorry, and for me, the silver lining, which is a story still being written on the pandemic, is that we're finally waking up to the vast and persistent inequities that have existed forever in the healthcare system. And so even, within my own system, we couldn't, we used to say actually the R word. We could not say racism because it was deemed to be pejorative. You couldn't talk about that. You could talk about bias. You could talk about implicit bias. You can talk about those things. But finally, we're using two words, frequently. Structural racism as a concept, but also that health inequities and health disparities, and really recognizing them. And I think that COVID really did lay bare all of those inequities that were not really hidden. They were kind of hidden in plain sight. We knew Black babies were dying more often than white babies. And we knew that Black mothers were dying more often than white mothers. But, with COVID, it was so clear. And you could actually just by observation see, in the clinical arenas, the difference in the patient populations of hospitals. And so people now are focused on it, and they are asking what they can do. So I think that creates a true opportunity for change. And we're seeing it as we're discussing the accrual for COVID vaccine trials. We're seeing it as we're talking about and planning for how we'll distribute a vaccine in an equitable way. So I think the equity piece is a hopeful piece that we're going to really begin to address some of these longstanding issues that have plagued us as a nation. David, I don't know if that's hopeful. Does it still feel
and I would add that there has been so much momentum of activism, so we have something to build upon, and you see the enthusiasm of young people who are coming out, and young people became galvanized to some extent after the Great Recession in 2008, 2009, when they saw the devastation of the economy at that time, which wasn't even, it was bad, but not even as bad as this, and felt like, my gosh, my parents lost their job. Things that seemed secure were no longer secure, and it shows in polling that they are more receptive to the idea that government has a role to play, that capitalism and the private sector doesn't solve everything. And that kind of psychic shift that needs to happen, which maybe the elderly folks haven't embraced as much. Well, they do once they get to Medicare. Maybe it's the people kind of in our age bracket, Wanda, who still think have hung on to, the market will sort this out. And I write it a lot about that in the book. The market isn't going to solve it. This is my Kennedy School training. There are market failures, and that we need a combination of some government involvement, regulation, guardrails, whatever you want to call it, and you can still benefit from positive aspects of market forces, but you've got to put the two together. And so we see that young people, I think, are more willing generally in our population to accept that premise. And as they're moving on up and this crisis is happening, I think we'll have more of a critical mass. So while I focused on women, there is this whole very large subtext of also the young people who are galvanized by issues like climate change, gun control, Black Lives Matter, and healthcare for all. So I see hope there very much.
I'll ask one more question if that's all right, which is just I just couldn't agree how important this is, and about how many things have really been highlighted by the current pandemic. But one of the challenges, of course, is a lot of things have been highlighted by the current pandemic. The people that are in the so-called essential jobs who aren't in healthcare, we call those jobs, we have another name for those jobs, bad jobs. The job, we've also seen it's healthcare, but it's also obviously public health. And well beyond that, the whole set of issues around climate change and everything else is forefront. And so part of what I'm wondering is, here's my fear, and tell me how this movement can solve this problem, which is, as your book makes clear, healthcare as a right is absolutely straightforward. It's simple. It's got to be done. But an actual healthcare plan is not a simple thing, and it's complicated. And I was struck by, in reading your book, remembering three things when I was in government during the Clinton administration. And I remember before I went, well-known professor here said to me, look, you got to solve this problem or whatever healthcare plan you guys put out will fail. They said 80% of the American public thinks the healthcare system is broken, and 80% of the healthcare people think their healthcare system their health plan is just fine. And if you don't solve that problem, that it's obvious. It's a one-liner. They're going to screw yours up. And that was pretty interesting. Then there was another point late in the day when the First Lady's healthcare plan was moving forward, and David Gergen actually came up and said, look, this seems really, really complicated. Can you tell me that this is going to be explainable to the American people? And I mumbled. And that was a worry. And then finally, to push back just slightly on some of these, not all the states have tons of African Americans that said no. Some of them are pretty white states, like North Dakota, some of these places where, and some of it is, and Wanda, you made this point, there is this sense, and you hear this quite frequently, that I'm grateful, you say in your book, I'm grateful that I'm getting subsidized health insurance, but it seems really unfair that I'm working and my neighbor who's not working at all gets it for free. And while I completely disagree with the premise, you can understand the feeling and this. And so when I look and see what's really succeeded, it was Medicare for all. It's real simple. Everybody's going to get it. It's not that you have to pay in. It's not that there's partly private. It's not this and that. And maybe it's Medicare for all where it's you're in, but you can opt out into a private sector. That's fine. I'm wondering, but the Massachusetts, the problem is what the opponents always try and do is say, oh, it's too complicated. It's complicated. They'll screw yours up. All the things that I'm talking, and they're going to give it to them, but not you. How do you drive a movement that says, actually, it's not so hard, even though it's complicated?
Okay. Let's unpack that. There's several questions in there, but this is great. Okay. So first of all, a movement does have to have things that people can put on a sign or a T-shirt, so that healthcare is a right, and Marshall Gans teaches about this kind of stuff at the Kennedy School, and so it has to boil down to that. And what I've been trying to say to people is, you don't have to become the policy wonk. Now, not in this audience, I kind of wish you would, but to other folks outside of the Kennedy School, I want people to not run away from this because of it being complicated. So I try to say it's the notion of like being on a board of directors where you want to set the direction, but you're going to anoint the management team to go and actually do it and figure out the details. And so we anoint the people that we elect to go in there and do the things that, geniuses like Nancy Pelosi know how to do legislatively and get through all those staffers in Washington. There's incredible folks there, think tank people. They can worry about all of those details, but they need the pressure of the populace to say, we want this done. And so because otherwise it can get hard when you're going through all the details. But if there's an incredible political pressure to do it and an expectation that it's going to get done, that will really help. And a lot of those insiders have said those very things. Those are some of the lessons learned, I think, from the Clinton experience where it was complicated. You said you mumbled, and you didn't have the population behind saying, we want this, and keeping the pressure on. And so it was kind of easy for the insurers to just frankly come and torpedo it. So that's part of my answer. I did work, two bright spots. This past summer, 2 states through ballot initiative passed the Medicaid expansion. That's Oklahoma and Missouri. And it was close. but those fairly red states passed Medicaid expansion in this era. And I do think the pandemic had something to do with it, but grassroots organizing, if you know the story behind the story, had a ton to do with it. So it's possible. Unfortunately, a bunch of states like in the South don't have ballot initiative option. It has to happen through the legislature. Then you're stuck with all the issues around that, which is gerrymandering. That's a whole other topic. But the fact is there's some increasing will in some of the states. I did some work in Kansas a year ago. They were very close to working this through legislatively. And unfortunately, it got derailed last spring. But it was very much, they brought me in to go talk to chambers of commerce about the fact that most folks who needed the Medicaid expansion were working. The vast majority were working. And there was the chambers were all like, yes, we will go talk to the Republican legislators because we need this to stay viable, economically. And this, again, was pre-pandemic. So it was starting, it had taken years and some very dedicated people, but I felt like folks were starting to see that from both sides, the other side of the aisle. So this notion of people not working, that can be overcome. I think, and data really can help, for sure. And I saw it with my own eyes. And then lastly, the path I suggest in the book really is very much has a buy-in component. And when you think of the models of Social Security and Medicare, there's dignity in feeling that you've contributed to something and then you get something back. And so setting it up like that, so it's not just some perceived handout, but that it has this, you give some, you get some, that has worked with some of our other social programs is really, I think, the answer.
And Rosemarie, I also think, when I think about the ACA in particular, I think some of the things that were built into it, like the pre-existing conditions protection, like having kids stay on their parents' plans until 26, there was political savvy in adding those kinds of things into this, because once people have a benefit, hopefully they'll recognize it and fight for it. So I think, again, from a policy perspective, really listening to what people tell us they need and then building that in is another really important strategy.
Totally. And I really believe that this pre-existing condition thing, which, by the way, when I took the job in Massachusetts and my boss, who was an insurance guru, told me, I was like, wait, what is that? I don't even know what you're talking about. And no one knew what we were talking about when we would use those words. In the entire 4 years I did that in Massachusetts, but now it's like the whole country knows what that is. It has brought us so much closer to making healthcare a right. I see that as profoundly positive because people don't want to lose that. Just like you can't touch aspects of Medicare, right? That's become a third rail. It's appearing that the pre-existing condition protections have become a third rail.
I know. I think it's very important. So I'd like to open it up for questions. Jessica, I think you're on the line, but I don't. Can people in this format actually raise their hand? I don't see a hand raising function when I put on participants. Normally, if you go into participants, there's a hand raised, but maybe not here. So otherwise, then, if you could quickly do a chat, say you'd like, you could even just send me a note saying you'd like to ask a question, and I'd be happy to call on you. I'm going to wait for just a second and ask. Otherwise, you'll get stuck with me asking questions. It's a big mistake. I am going to ask a question, though, which is, I actually, of all the comments that I'd heard back during the Clinton era or whatever else, I think the idea that I don't think people understood what was in the ACA. I'm not sure they still do. And I think that the part of this that needs to make it as a movement is it really has to be easy enough to understand, and people have to, frankly, I'm not sure a lot of work was done to try and communicate to people. And so I really think you got to reach them. We do have a question from Kathy McLaughlin. So I'll turn to her. And Kathy, I'm going to unmute. I assume Jessica can unmute everyone, or at least unmute Kathy. And
yay!
Kathy, can you
Hi.
ask?
Hi, Rosemary. Hi, David. How are you all?
They're
Hey.
good.
I just wanted to say, well, first of all, it was great to hear you today. It's been a long time. And congratulations. I think the book is a great thing. The one thing I wanted to mention, which I thought you might find helpful, is I now work, Rosemary, I don't know if you know, I'm down at the Biden Institute at the University of Delaware.
Yeah, whatever happened to Joe Biden?
Whatever happened to him? He's a little busy these days, but am I showing up on your screen? Anyways, but the good news is I had a great meeting the other night, and I thought you'd appreciate this, with 25 young people, and said, okay, so what can we do to help make your lives better? What do you want to do? And the one thing that they talked about, and we're going to be doing a class on, is, and we're calling it from protest to policy. So they're really interested in how do you get to that next phase.
Oh, I love that.
Which I think is great. So we literally talked about it this morning on a call, and talked about the fact that it's sort of interesting for the students to really be pushing hard to figure out how to make that leap. So I think that's a positive thing. And I see that we work with 25 other colleges, and we get that same kind of reaction from them as well. But what other advice do you have? Like, if we're going to put together a class on from protest to policy, what would you suggest?
Well, it sounds like the Kennedy School, if they don't have that class, I love it. It's even, I got to catch me.
We're falling behind Biden Institute. It's a challenge.
So I can think of a lot of things. You know, I think there's the whole aspect of the power of social media, and the debate about whether that's a force for good or a force for evil. So I think that would have to be some kind of component, right? When I think of like the Shorenstein Center on Press Politics and Public Policy, but it's like that aspect is just so mushroomed. And so that's how to harness the power of social media to rally more people for the protest, but then getting people to, I mean, for me, like I link to some of the stuff that's coming out of think tanks and what have you. It's depending on who you follow, you can have a great feed for the policy ideas. And there are amazing organizations that translate from the really wonky to kind of what's digestible. And I think of Commonwealth Fund and Kaiser Family Foundation. They're just amazing at how they put out the information. So people who have some appetite for policy can start to get really educated. And so be contributing to that in some way, and then moving that into the congressional and gubernatorial and presidential staff. You know, and there was a really interesting piece somebody sent my way from Brookings about the women behind the scenes who were the staffers that so Jean Lambrou and Nancy Andeparle. Yeah.
Nancy Andeparle.
Yeah. Yes. They wrote a piece about how many, comparing to when the Clinton piece was attempted, and now that a lot of women had moved up through the ranks, and they are not high profile necessarily, but they were at the table in seats that were the staffers who were like the right-hand person to the decision makers, also leading the advocacy organizations, also leading the trade groups. And that there was something about that was really interesting. So there's that component of the diversity working all the way. I talk about the people getting elected, but there's so much in between. And I think that's inspiring, because not every student's going to become an elected official, but there's so many amazing jobs you could do where you connect these dots.
Right. Great. Well, thank you.
I don't know. That's helpful, and I would be happy to talk to any of the people in classes like that.
Okay. Don't say that if you don't believe it.
I actually went from policy to protest.
Right.
I always saw myself as an inside person, and I went a place I didn't think I was going to go, but the times called for it. So that's another piece.
So let me ask both of you, fair number of folks here have obviously a Kennedy School connection. What, I guess, two different related things, you can pick either one. Was there something that you learned at the Kennedy School that's been enormous, that's been particularly valuable, but I'm particularly interested in what should we have been teaching about at the Kennedy School that we didn't? That people really need to know now. And maybe maybe it's new, maybe it's old, but what should we be doing more?
I know, I mean, you have the Center for Public Leadership that didn't exist when Wanda and I were students there, and now it's part of the institution in a really strong way. I think that is extremely important, and so more of that it would be really good. And the only other thing I'd say off the top of my head is, honestly, and I'm not just trying to suck up, David, but I really understood economics when I got to the Kennedy School in a way I didn't understand as undergrad. And I realized, looking back, my undergrad curriculum was very biased to the free market as the savior. And the teachers I had were like Reagan acolytes. I didn't know that at the time. I just thought I was learning pure economics. I cut to the Kennedy School and I find out about these things called market failures and all that. It profoundly impacted me and made me think, oh, I'm not dumb about economics. Now it actually makes sense to me from a more humanitarian, like holistic view. The Kennedy School really did that, and I carried that into my book because I still think the prevailing culture, the people in power anyway, certainly who have economic power, worship the free market in some kind of way that just isn't, well, it's so inequitable and there's so many problems with it. But the Kennedy School did that really well, I thought.
Wanda?
Yeah, I think in some ways it's what we were talking about today, the activism part. There was, a lot of Kennedy School students, myself included, were really passionate, but I think that we see a different level of activism now than I remember. And obviously there were protest movements earlier, but I think we may have been there in a time that was relatively quiet on that end of the spectrum. Mm-hmm. Or maybe I'm just remembering it, misremembering it that way. But so I do think teaching people how to use their, collective power to transform systems may be an important thing. For me at the Kennedy School, so the things that I use quite a bit, and one of them was is negotiations. I took one of the negotiations class, and it was just incredibly transformative in terms of how I approached, working with other people and problem solving. And then reading again at the beginning of Rosemarie's book reminded me of John Rawls, where I had not heard anything about him in my life until I got to the Kennedy School. And I think that just transformed how I think about social justice. And if we could get people to understand that kind of invisible, what is it? The veil of ignorance or something like that. I was going to go invisible hand, which is a whole different concept. But that the veil of ignorance, that, if you put yourself in someone else's, if you don't know who you are and you had to create a society, would you create the one we live in? And that just, to me, is just so profound. And if we can get people to think that way, I think we'd have a better country.
That's great. I'm going to take one last question here, but I couldn't agree more, honestly, with both this sort of, I've been in the world of policy, and I think the danger of policy is you think small, you don't think about the really big picture. You do what each incremental step. I always used to call myself a radical incrementalist. I think I still am. But sometimes you have to be much bigger. And I really thank you both for thinking about that kind of thing. I would also add the things that both of you have talked about in terms of structural racism. I just part of a group last few years that we did site visits across the country and on issues of mobility, and you just couldn't escape race, structural racism, on everything from from the labor market to obviously justice and so on. Let me end with a question from Mino Gorishi. You may see it there. It says, thank you for the informative session, but how can one best learn about the complicated healthcare system? I'm tempted to say this book is an excellent primer, is a good start. It really is. She does have some remarkably understandable thinking about how healthcare works, how health insurance works, again, the social determinants of health and so on, but then goes to the broader things. Do either one of you want to point to any other books that if someone really wants to understand healthcare as we see it now in the United States that they should particularly point to?
Well, I think if you want to understand kind of structural racism in healthcare, Medical Apartheid is probably a book that I would recommend. But I could not agree with you more. And I'm not just saying this because Rosemarie is my friend, but her book is packed full of knowledge and information in an accessible way. It is readable, and it is as if you're talking to her. So I would encourage the questioner to read her book.
You know, I tried to boil the ocean to an extent with the book, but I had several favorite references, and I'm not going to remember all of them off the top of my head, but you will notice the footnotes and some of those go-to sources. And I think I mentioned T.R. Reid, Healing of America, and he wrote, this is like 10 years ago, but he really opened my eyes at that time to what other countries were doing and how they had made healthcare right in a variety of ways that were not just England's National Health Service. And so that to me gave tremendous perspective. And I don't know if such a good book has been written since that's so accessible on those things. So I highly recommend that. And then there was a tremendous book on the social determinants of health that really also opened my eyes that Elizabeth Bradley and Lauren Taylor did. And the title is like, not at the tip of my tongue, but it's referenced a lot in my book. So there are, yeah, the book points the way to some other really good sources.
All right, Rosemarie and Wanda, thank you so much. Exciting, and hopefully even within weeks we'll see women's marches where healthcare is a right. The signs are 5 times larger and more common. But also, I very much love the idea of from protest to policy. Ultimately, it's got to make something's got to happen. It's got to work. Rosemarie's been at the center of all these things for many years. So has Wanda, and so it's been an enormous honor to be here with the two of you. I wish you all the very best, and I hope someday to say hello again in person. So with that, thank you all very much. Bye-bye.
Thank you.
Thanks for attending.
Thank you, everyone.
Bye-bye.
Bye.
Thank you. Bye.